Anxiety can feel very obvious and very loud some of the time. Racing heart, tight muscles, difficulty concentrating. And other times, it can be so slippery and sneaky that you don't even know that it's there. Like just now, for example, I caught myself in an utter decision paralysis about how to start this video. I don't necessarily feel anxious, but I've learned, and what I teach my clients, is that anxiety is predictable, patterned, and persistent. What that really means is that anxiety operates by making us follow certain rules. Over the past decade that I've been doing this and lots of research on the topic, I see these rules of anxiety show up all the time. And that's because anxiety's got one job for all of us, and that is to keep us small, safe, and separate. So it was there in the background whispering to me that I shouldn't make this video unless it is absolutely perfect. It's the demand for control and certainty. It's insisting that I shouldn't take any risks and start this video by talking about my own anxiety. That's the smallest safe directive. It's also telling me to give up on making videos and stick to doing therapy because that's what I know best. That's the law of inadequacy. But actually, I think this is the perfect way to start a video talking about my new treatment program for anxiety because it gives me the opportunity to explain to you that this is not an anxiety group about deep breathing, mantras, or guided meditations. I don't do that. This is a program that I've designed to create a real paradigm shift in the way that we handle our relationship with anxiety. I've been a therapist for nearly 10 years, and I hear all of the time from clients and colleagues telling me that some people with anxiety are feeling really frustrated by continuing to be trapped in the same cycles of anxiety or avoidance. A bit like me starting this video. Despite knowing what's going on intellectually, they're frustrated with not having the tools or techniques to really shift things. Many have tried traditional therapy but find it lacking, either too focused on the past, not practical enough, or just not seeing any change. And above all, they want smart, actionable strategies, not fluff. They want to know why and how change happens and how to make it stick. And that is exactly what we're offering. The program is designed to guide and cultivate 5 attitudes that are central to empowering clients to navigate and overcome their anxiety. These are presented as a therapeutic mindset, something that can be learned, embodied, and practiced. We're going to be introducing one of these attitudes a week, and the 6th week is all about integration and fine-tuning. The first attitude that we're asking you to embrace is the scientist. This week is all about opening the door to a new way of seeing things. It's an attitude that encourages clients to adopt a stance of detached curiosity towards their anxiety. It's much like a scientist trying to observe something in nature. Anxiety isn't a thing that just happens or a disease that needs to be cured. It's a feeling that everyone has. Just in some people, the rules and the way that it plays is hardwired differently. I think the people that know me best know that I am very visual. So everything in this group is either experiential and every component has some visual element, like a journey map. This is adapted from business consulting. It charts an anxious experience from start to finish. So Cedars-Sinai did this, and they mapped out the journey that people go through when they arrive in the ER all the way through to discharge. And what they found from this exercise is that people were most scared, not when they were going into surgery or meeting a doctor, but when they were in the waiting room alone. Although this is a business consulting tool, it really helps us understand as therapists and helps our clients to understand their journey, where they feel the most and what happens. And because this is a group activity, we'll be able to see where the current skills and tools fail. Because if they worked, they wouldn't be in the group. So clients will walk away with tools like the 3-gate worry check, the priority ping matrix. These are structured ways to help build that observer stance. In the 2nd week, we're encouraging the attitude of the detective. Once we've observed everything, we need to investigate. So the detective attitude is about digging into rules, triggers, repetitive strategies. We'll use a group technique called relational mapping. It's an exercise that helps us analyze how anxiety's engine operates in everyone. It's messy, it's collaborative, it's fun. Again, my groups are interactive and visual and engaging because I refuse to be known or thought of as boring. Floating along the ocean. We need to talk about the ocean that is holding all of these boats up. In week 3, we lean into the idea that change doesn't come from waiting until you're ready. It comes from trying something new, even if it's a little uncomfortable. So this group is all about worry, Judd Brewer's research and inferential confusion. And this group sort of blends those two frameworks because we're going to treat worry like a habit. All habits stick around for a reason, and that is because they deliver a payoff. It also means that if worry is a habit, we can break the habit. Week 4 is about the judge. We're going to start treating yourself like someone who is worth listening to. So in this week, we're first of all going to get the group to see how we operate as parts. We're going to get clear on all of the parts that our clients have. And we've covered at least one already, the doubt dementor. We're going to talk about the critical superego, and we'll map these out using a psychodrama technique that isn't actually psychodrama. It's kind of like the thing you do before you get into the psychodrama, called sociograms and sociometrics. Again, it's visual, it's collaborative, and it gives us things to process and talk about. The game changer is week 5, and it's all about breaking anxiety's rules and rewriting them. Everything we've gone through so far leads to this point. The game changer attitude is all about stepping out of being passively the victim of anxiety and then rewriting your relationship with it. So we bring in the 10 rules of anxiety, which we've already spoken about throughout the group, and teach clients how to break them strategically and paradoxically by embracing like a whole new set of personal principles. So I really hope this video has helped you get a bit of an understanding of what's in my head, what my approach to anxiety treatment is, and a little bit more about the anxiety group therapy project that I'm launching real soon. And if you are still watching at this point, you may as well just sign up for a consultation call and we'll talk you through what we need to do next and how to get you on board and started. Links are all below.